Hi, my name is Darius. I'll be your lab instructor today, and we'll be going over some specific bones of the skull. Once again, I'll be using the cengage 3D model as well as some information from anatomy.net. The frontal bone is an unpaired bowl-shaped bone located in the forehead region, which contributes in forming the cranium. The frontal bone lies superior to the nasal bone and anterior to the parietal bones. The frontal bone has four parts: squamous part, two orbital parts, and the nasal part. These two notches here are known as the supraorbital notch, sometimes presenting the supraorbital foramen. It is an opening presented as a notch or a hole located on each of the supraorbital margins of the frontal bone. The supraorbital notch or foramen is the passage for the supraorbital artery and the lateral branch of the supraorbital nerve. It is also a pressure point for the ophthalmic branch of the trigeminal nerve. The occipital bone is a single bone and consists of four parts that surround the foramen magnum. The four parts forming the occipital bone are following: basilar part, lateral part, which is bilaterally, and the squamous part. Each lateral part of the occipital bone has an internal and external surface. The internal surface of the lateral part of the occipital bone presents the groove for the sigmoid sinus. The groove for the sigmoid sinus is located in the posterior cranial fossa found on the lateral part of the occipital bone, then curving around the jugular process on the mastoid part of the temporal bone, finally turning sharply on the inner surface of the parietal bone, continuing as the transverse groove. The temporal bone is a paired bone situated on the lateral side and base of the skull. The temporal bone features important structures of the vestibulocochlear apparatus, including the external acoustic meatus, the tympanic cavity, and the structures of the inner ear. This little notch right here is known as the foramen lacerum, and it's a triangular shaped hole in the base of the skull located between the sphenoid bone, the apex of the petrous part, and the temporal bone, and the basilar part of the occipital bone. The foramen lacerum fills with cartilage after birth. The temporal bone also houses the tympanic cavity and the internal ear. The squamous part of the temporal bone is the largest and most superiorly situated part of the temporal bone. The squamous part has two surfaces: temporal outer and cerebral, which is the inner surface. What I have highlighted now is the zygomatic process of the temporal bone. It's an extension of the temporal bone that contributes to the formation of the zygomatic arch. It extends from the temporal surface of the squamous part of the temporal bone. Note that any zygomatic process is the process of a bone which articulates with the zygomatic bone. And as you can see, this is bilateral. The parietal bone is located on each side of the skull, right behind the frontal bone. Both parietal bones together form most of the cranial roof and sides of the skull. Each parietal bone takes an irregular quadrilateral shape and has 4 angles, 4 margins, and 2 surfaces. The parietal foramen is an opening occasionally present at the back part of the parietal bone that serves as a passage for the parietal emissary vein, which drains into the superior sagittal sinus. The body of the sphenoid is the central portion of the sphenoid bone located between the wings and processes of the sphenoid and housing the sphenoidal sinuses. The sphenoid body has 6 surfaces: superior, posterior, anterior, inferior, and 2 lateral sides. The greater wings of the sphenoid are the larger of the 2 lateral wing-like extensions of the sphenoid bone, or body, The greater wings curve upward, laterally, and backwards to form a prominent concavity or fossa in the middle of the cranial floor. The foramen rotundum is a circular hole in the greater wing of the sphenoid. Located right here. No. It is a passage for the maxillary branch of the trigeminal nerve. The ethmoid bone is an unpaired bone of the skull that contributes to the medial wall of the orbit, the nasal cavity, and the nasal septum. The ethmoid bone includes the cribriform plate with openings that transmit the olfactory nerves, and it is also houses paranasal sinuses called the ethmoidal air cells. There are 4 parts to the ethmoid bone: cerebriform plate, perpendicular plate, and 2 ethmoidal labyrinth. The zygomatic bone, also known as the cheekbone or malar bone, is a paired facial bone situated in the upper lateral part of the face, forming the prominence of the cheek. The zygomatic bone also takes part in forming the floor of the orbit, as well as the temporal fossa and the infratemporal fossa. The zygomatic bone articulates with 4 bones: the maxilla, the temporal bone, the sphenoid, and the frontal bone. The zygomatic cofacial foramen is 1 or 2 openings on the facial surface of the zygomatic bone near its orbital border. It can sometimes be absent. This opening leads into the zygomatic nerve and is a passage for the zygomatic nerve and zygomatic blood vessels. The mandible, or the lower jaw, is the only movable cranial bone. The mandible is a large bone connected to the skull by the temporomandibular joint. It consists of three parts: the body of the mandible and the ramus of the mandible bilaterally. The mental foramen is an opening in the mandible located below the second premolar. It is the passage for the mental nerve as well as a pressure point for the mandibular branch of the trigeminal nerve. These notches right here, interior of the mandibular bone, are known as the mandibular foramen. And it is an opening on the inner surface of each ramus of the mandible leading into the mandibular canal. The maxilla, or upper jaw, is a paired bone that has a body and four processes: the frontal process, the zygomatic process, the palatine process, and alveolar process. The two maxillary bones are fused in the midline by the intermaxillary suture to form the upper jaw. The body of the maxilla is the central portion of the maxilla housing the maxillary sinus and supporting the four processes of the maxilla. The two notches here, or foramen, are called the infraorbital foramen, and they're openings on the anterior surface of the body located below the infraorbital margin. It is the outer opening of the infraorbital canal, serving as the passage for the infraorbital nerve, as well as for the infraorbital artery and vein. The nasal bone is a paired bone forming the anterior wall of the nasal cavity, and it is largely responsible for the shape of the nose. The nasal bones are variable in size and form in different individuals. Each nasal bone has two surfaces, an outer and inner, and four borders: superior, inferior, medial, and lateral. The outer surface of the nasal bone is convex from side to side and covered by the porcerus and nasalis muscles. What I have highlighted here is the lacrimal bone, and it's the smallest and thinnest bone of the skull. This bone is paired and lies anteriorly in the medial wall of the orbit. The vomer is an unpaired midline bone which, along the perpendicular plate of the ethmoid, forms the nasal septum. The vomer is a single facial bone that takes a form of a plate, and its superior border gives two extensions called wings. With the help of these wings, the vomer attaches to the inferior surface of the body of the sphenoid bone. The vomer also articulates with the ethmoid bone, both palatine bones, and both maxillary bones. The vomer is situated in a sagittal plane and forms part of the inferior part of the nasal septum, while the perpendicular plate of the ethmoid bone forms the superior part. The palatine bone is a thin paired bone that participates in forming the nasal and oral cavities, as well as the pterygopalatine fossa. This isolating the palatine foramen refers to one or more small foramina representing the openings in the hard palate of the lesser palatine canal that carries the lesser palatine nerves. And what's keeping it all together is what's called cranial sutures, which are fibrous joints connecting the bones of the skull. The dense fibrous tissue that connects the sutures is made mostly of collagen, also referred to as the synarthrosis. And last and definitely not least is the largest foramen of the skull, the foramen magnum, which is inferior portion of the skull, and it is part of the occipital bone.